Do you think that any of the young scientists that Damon Runyon is working with encounter any sort of challenges throughout their research?
Yeah, I think it's really hard to be a young researcher today. It's a very competitive space, and the funding hasn't been as strong as it has been in the past. So to be able to get the funding to try something new and risky is very, very hard for young scientists. So what we try to do is enable them to get the funding early on, the seed funding that would prove to the more traditional funders that their ideas have validity and they should be funded. So in many ways what we do is we start them up and then hope that they'll go on to get NIH funding and some of the bigger grants that are available. And as a young scientist too, when you think about a PhD scientist just having spent 7 years or so to get their PhD and now continuing their training as a postdoctoral fellow, they're making at best in the $50,000 a year, where their peers in law and business and technology are all making much, much more than that. So we do everything we can to try to encourage really brilliant people to go into and stay in research, because these are the people who are going to transform our lives.
And so technology is very transformative and also very cutting edge as well. How do you see that the Damon Runyon researchers are using technology in their projects?
Well, most importantly, they're developing the technology. So, you hear in this meeting about CRISPR technology, which enables gene editing. One of our scientists was one of the original inventors of some of the technology that's being used today by literally every single scientist in the world. And, what I see is that technology is really driving the advancements we're making, if it's single-cell genomics or the CRISPR technology or imaging technology. And so we are very supportive of researchers who see a problem and they can't answer the question because there's no technology that enables them to do it. And we fund them to develop that technology.
So of all the advancements that we've seen maybe over the last year or two, what would be the one that you think is probably the most important?
There are so many. I know that everyone's going to say immunotherapy, because that's the really exciting thing. You're seeing patients who had no hope who are being cured of some cancers. But the real challenge is that it's not every patient, and we don't know why. So I would say that there's as much work to be done as has been done to really get to the heart of how we're going to be able to prevent, diagnose early, and treat all forms of cancer. So to pick one place, I think, I hate doing that because I see so many different promising areas, whether it's, understanding the microbiome and its role in cancer, understanding cancer metabolism and whether that's a way to uniquely target cancer cells. Genomics is amazing. Immunotherapy is amazing. I see so many different areas of research moving so rapidly and accelerating that I don't want to bet on which is going to be the most important for patients, but from Damon Runyon's perspective, there's one common denominator, and that's brilliant scientists. If we have the smartest people working in all these different areas, we're going to blow this all open.
Well, I know we have one of your brilliant scientists coming in to sit with us shortly, and it was really a pleasure to talk with you today at ASCO. Thank you.
Thank you so much.